This is a different presentation about surgery now. And looking at the results in Africa, it was very interesting for me to research this topic. It was actually an eye-opener for me. First, a few very important numbers. In Africa, there are around 1/5 of the population of the world and around 1/5 of the land area of the world. And it's only second to Asia in both categories. But it's very important that sub-Saharan Africa is the fastest growing population worldwide, where it tripled in the last 60 years. And Africa is nearly the exclusive home for the 20th lower income countries. Gross national income per capita. If you look at this map, the lighter the color, the lower the GNI per capita in the worldwide. And you can find the light color in Africa and in southeast of Asia, basically distribution. And if you looked at the distribution of rheumatic fever, and rheumatic affection, or rheumatic cardiac affection, is nearly identical to countries with lower GNI per capita. In 2018, the WHO agenda actually gave us very important numbers. There are around 30 million people are currently thought to be affected by rheumatic heart disease globally. In 2015, rheumatic heart disease was estimated to have been responsible for around 305,000 deaths and 11.5 million disability-adjusted life years lost. These figures are very uncertain owing to incomplete data in many countries. Rheumatic heart disease persists in countries all over the WHO regions, not only in these countries, but Africa and Southeast Asia and the Western Pacific regions are the worst affected, accounting for 84% of all prevalent cases and 80% of all estimated deaths due to rheumatic heart disease in 2015. The excess of cardiac surgery in sub-Saharan Africa is really minimal. Surgery remains a luxury in low and middle income countries. Only 6% of the world's total number of surgical interventions takes place in the poor third of the world population, compared to 74% of all major surgeries performed in the wealthiest third. This is particularly true for cardiac surgery, where services are often completely absent, further creating disparities in accessing cardiac care. For example, in North America and Europe, there is one cardiac center per 120,000 people, compared to one cardiac center per 38 million people in sub-Saharan Africa. The numbers are stunning. From looking at the numbers, here, even if you look at Central Africa, it's around one center for 132 million people. If you look at North Africa, which is the best area in Africa, there is one center per 1.8 million people in North Africa. If we just give you an idea, anecdotal idea about the problem, we're going to look at some reports from 4 countries in Africa. The first report from the Democratic Republic of Congo. This is the 4th poorest country in Africa. It's number 164 in the WHO classification for GNI per capita in 2018 of $900 per capita. And the population is 86 million people nearly, and it is the 8th most populous country in Africa. And you can see this report here, published in September 17th, 2018, and reporting the first 2 open heart surgeries performed in the Democratic Republic of Congo. So imagine that just in 2017, the Democratic Republic of Congo started doing open heart surgery. Another country which is very important to look at is the biggest country is Africa, the most populous country is Africa, is Nigeria. The GNI per capita is 1,960, and the population is 208 million. And you can look at the centers in Nigeria performing, that's published in 2016, performing open heart surgery. And there are 15 centers, mostly depending on international missions. And the total number in 10 years is around 490, around 500 cases. So nearly minimal open heart surgery in Nigeria also. Another country is Uganda. Nearly the same GNI per capita as Nigeria, and you can find out that Uganda in 2007, this is started the first report of 2 open heart surgery reported in Uganda 2007, and here again in the first open heart surgery just for CABG was performed last year in Uganda. This is really stunning for me actually. The fourth example is Ghana, with a higher GNI per capita, 4,640. And you can see this report here, 2016, that they've got like around 1,000 cases performed between 2002 and 2011. And the reason for that, they have bigger numbers than the previous countries, that the German actually invested in this country very well. They invested not only in money and equipment, but invested in personnel. They trained the indigenous Ghana's surgeon, and they had anesthetists, nurses, perfusionists, cardiologists, not only for visits, but they stayed between 2 and 10 years in Ghana to train the people. So they have a successful story. In 2018, this was a very important paper published by actually the major cardiac surgeons worldwide, studying the global unmet needs in cardiac surgery, and very important numbers were there. And the data of 1 low-income country, the Mozambique, and 12 medium-income countries and 3 high-income countries were collected over 12 months. Need for cardiothoracic surgery in sub-Saharan Africa was estimated to be 200 to 250 open heart surgery per million of population, mainly rheumatic and congenital pathology. In developed countries, however, an estimate of 1,300 million due to ischemic and degenerative burden, and there is a big gap here. The transition in medium-income countries with the decrease in the incidence of rheumatic pathology is overcompensated by the increase in degenerative and ischemic pathologies. And this is the situation we've got in Egypt here. Only a weak correlation between the GNI per capita and the provision of cardiac surgery, even if related to health expenditure. Iran and South Africa, for example, have instance spent nearly identical per capita amounts in health, yet Iran performs 525 cardiac operations per million, as opposed to 142 in South Africa. Again, in Nigeria, exactly the same. The number of open heart centers in the countries, as you look in Africa here, 0.06 per million, 0.9 per million, as compared in Brazil is around 10, and in Germany around 11.5, so the number of centers is quite small in Africa. The lack of access to cardiac surgery is most glaring in Africa, and almost 1 billion people living in sub-Saharan Africa outside South Africa have access to only 22 cardiac centers. There are 1,022 open heart operations per million population in North America and 18 per million in Africa. This translates into 1 center per 120,000 people in the United States and 1 center per 33 million people in Africa. It is estimated then 10,000 cardiothoracic surgeons.
Dear doctor, your time is up.
1 minute. estimated that 10,000 cardiothoracic surgeons in 6,000 centers globally performed more than 2 million open heart operations per year. Africa has 18 operations per million people versus the global mean of 169 cases per year. The Cape Town Declaration to access to cardiac surgery in developing world actually is very important and was published 2018. They had a mission and have two aims. I'm not going to go through it because of time constraints, but basically it is a combination between different bodies of cardiac surgery, formed an alliance and included all the cardiac surgeons involved and the industry involved as well to support programs. And there was this is the call in 2019 to initiate programs in 3 countries, in Africa and in Asia.
Dear doctor, your time is up.
The way to go forward. Thank you very much.
Thank you.